Welcome to the Radiography Report. Today, I have with me Eamon, the expert radiographer. How are you today?
Fine, how are you?
I am great. Okay, so as a radiographer, can you tell me what resorption is and some different types of resorption?
Okay, so in dentistry, the term resorption is used to refer to changes that take place with respect to the roots of teeth. So there are two types of resorption. First one is internal and the second one is external resorption. So internal and external resorption is composed of gradual loss of root canal and dentin.
Wonderful. And what are the differences between these two types?
So there are many differences in internal and external resorption. First of all, resorption is considered to be internal if the origin site of the resorption starts in the pulp. And the second one is external resorption if the origin site is the periodontal ligament.
Very interesting. So, what are the causes of internal and external resorption?
Okay, so internal resorption is caused by chronic pulpitis and infections, and while external resorption is usually caused by trauma or orthodontic movements.
Very, very nice. So, how exactly can you treat this?
Okay, so internal resorption is treated by endodontics, also known as root canal therapy, and external resorption is hard to treat compared to internal resorption. However, it can be treated by moving the tissue and bending the roots of the tooth. If the patient teeth are diagnosed with late external resorption, then it is suggested to extract the teeth.
Wonderful. Thanks so much. That was very interesting.
Thank you. Thank you for having me.
No problem.
The following program has been brought to you by Dentists in the Wilderness.
Ooh, ouchie.
If you are found to have a chronically inflamed localized mass, it can be treated. With pulpal death, it can develop into a periapical cyst or abscess. It is normally asymptomatic, so you may not even realize you have this granuloma. But if you are found to have a long history of sensitivity to hot, cold, or percussion, you may be at risk. Endodontics is the only treatment. The dentist will find a widened PDL space at the apex of the root, which shows as around unilocular radiolucency. A cyst is a lesion that develops over a long period of time. 50 to 70% of cysts in the oral region are found to be these, as they are the most common. The cyst appears as a round unilocular radiolucency from 5 mm to 1 cm. The dentist will find the borders can either be corticated or non-corticated. Root resorption can also occur. The granuloma can also develop into an abscess. It is a localized collection of pus in the periapical region. This can be acute or chronic, but pus and inflammation will be present. You may experience tooth sensitivity with the abscess, but this is common. The dentist will find that this is an apical round unilocular radiolucency with poorly defined margins, and the lamina dura cannot be seen.
As a patient of the wilderness, you may not be able to understand me, so please bear with me as I do not know all of these conditions.
As a dentist of the wilderness, I found the periapical radio-opacity on your radiograph. These can be seen as white, more dense areas.
Some of these conditions include hypercementosis, which is usually a condition described as too much cementum produced on the root surface. It can be caused by inflammation, supraeruption, and some trauma. There are usually no signs and symptoms other than excess cementum on the root. It develops rapidly than it should. Most of the cases are found just having a general dental checkup or a regular radiographic examination. This condition can happen all over the mouth or just in one specific area. Teeth affected are always vital, and the root is always the part most affected. The root looks bigger than normal and very round. The other condition is called condensing osteotitis. This is known as sclerosing osteomyelitis, which is another name for the condition. Well-pronounced circular focal opacity inferior to the root of a non-vital tooth. This can happen because of inflammation or trauma to the teeth. It is the most common periapical radiopacity seen in adult radiographs. The teeth most affected are the mandibular, rather than the maxillary teeth. The tooth most affected is the mandibular first premolar. Teeth that are normally involved with condensing osteolysis are usually non-vital and have big carious lesions and restorations present. The last condition is the sclerotic bone, which is also called osteosclerosis. It is a pronounced focal radiopacity, usually seen below the roots. The cause of this condition is unknown and inflammation is not connected with the condition. Usually it is found on the tooth and it can be all types and sizes and shapes. The margins are smooth or irregular and they're everywhere within a mouth. If you are experiencing any of these problems listed above that I've spoken about, make sure to book an endodontic treatment with your dentist at the earliest convenience. It is in your best interest to take care of these problems as soon as possible.
This has been Dentist in the Wilderness. You know, I really feel like going for a swim.
Ooh, ouchie.
And now we're back with the radiography report. Here we have our second expert, Nicole. How are you today?
I'm good. Thank you for having me.
No problem. Okay, so to begin, can you please tell me about the trauma that you've encountered lately? As a radiographer, how do you interpret it?
Well, you see, trauma is actually the result of any injury caused by an outside force. So this could affect the crowns of the teeth, the roots, or even the alveolar bone. And it may result in fractures or even tooth displacement.
Very cool. So what are some different kinds of fractures and how exactly do they appear on a radiograph?
Well, what a fracture means is it refers to a piece that's broken or broken off. So coronal fractures are the easiest to identify clinically because you can actually see where the top of the tooth has been broken off. In a radiograph, again, it just looks like part of the crown is missing. And what dentists will do is they'll take these radiographs in order to assess the damage to the pulp chamber.
So root fractures, are they harder to detect?
They are, because the thing with a root fracture is unless the central ray coming out of the PID unit is parallel with the fracture, the tooth morphology obscures it. So it has to go right on to see the fracture. So sometimes you can completely miss them. But over time, most root fractures, they'll either hemorrhage or get bigger over time, so you might be able to catch one later that you couldn't see at first.
Oh, wow. So how about jaw fractures?
The mandible is the most commonly broken bone of the face, probably because it's the only movable one. In the case of detecting a mandibular fracture, we need to take a panoramic x-ray. That way we can see the entire dentition and the jaw all together. And like with a root fracture, a jaw fracture appears as a radiolucent line.
So when it comes to tooth displacement, can you just be a bit more specific about that?
Sure. Tooth displacement is called luxation. And there are two different types. There's either extrusion or there's intrusion. Intrusion refers to a tooth that has been displaced into the alveolar bone, and extrusion is when it's been displaced, so it's coming further out of the alveolar bone.
Okay, very nice. So what about if the tooth was knocked out completely?
Stick it back in as fast as you can.
Okay, great tip. So what exactly would that injury look like on a radiograph?
Well, you would see an empty tooth socket, basically. Okay. So the dentist might use these images to check for splintered bone or anything else that might have gotten up there in the chance that you didn't get the tooth back in as fast as you could. Obviously clean it first. But
okay.
Yeah.
Awesome. So then you would definitely recommend wearing a mouth guard when playing contact sports then?
For sure.
Okay. Awesome. So thank you very much.
No
Welcome
problem.
back to the radiography report. I will be showing you some radiographic features on problems that can occur in the dental pulp. The pulp of the tooth is considered the living part of the tooth because it contains vessels and nerves. This is an example of a pupil lesion showing a deep caries extending into the pulp where the red arrow is pointing. It appears as a large radiolucency. Here is an example of a pupil stone. This is the calcification in the dental pulp They can be 3 millimeters in size and vary in shape from an oval to a circle. They become more common with age. Here we have an example on pupil sclerosis, which is a diffuse calcification of the pulp chamber, which results in the pulp cavity reducing in size. The image on the left is a normal pulp chamber, and the one on the right is pupil sclerosis. Lastly, we have an example of the pulp obliteration. It is an apparent loss of the pulp chamber. It appears as completely radiopaque, and it can be a result from trauma.
Closed captioning for this program is brought to you by Dentists in the Wilderness.
Thank you for watching!
What am I saying again?
No, don't laugh. Normally asymptomatic, so you may not even realize you have this granuloma. It's so
As a patient, circular focal opacity inferior to the root of a non-vital tooth.
I can't sit here for this. Listen to you butcher every